Hi everyone, this is Neil Wright, consultant audiologist and director of ClearWax. Thank you for joining me in my latest video using the WAXscope. And I'm actually recording this from Wrexham, which is a city located in northeast Wales, close to the border of England. And I'm actually in my hotel room. I've travelled from Leicester to Wrexham this afternoon after work because I've been invited to do a seminar tomorrow on the WAXscope for an NHS audiology department, and I believe some ENT may also be present for that seminar. So I've decided to come the night before instead of travelling at the wake of dawn tomorrow. So anyone who's based in Wales, Wrexham, a big hello. So this patient, you can see they've got quite wet, loose wax, and I've just applied some medical grade olive oil spray. And what the olive oil does, it helps to coagulate, bind this wax together. And it did it really, really well actually, because you'll see on both ears, once I got this superficial wetter wax out, the remaining wax came out in a plug. So quite blocked. At the moment, I can't really see the ear canal, so I'm trying to reveal the ear canal, and bingo, you can see some of the canal there now at 9 o'clock. And that gives me now a reference point. The right side is actually a lot worse than this, so do stay tuned for that. And again, with the WAXscope, because of the magnification, I'm just hovering just over the wax itself. I don't want to embed the suction tube any further and deeper because we just don't know how thick this layer of soft wax is, and we can quite easily make contact with the canal wall. So I'm just going over to the back slightly and then a bit higher up. So this patient actually attended with their son, so we performed ear wax removal in both their ears. I'll try and upload their sons tomorrow. So I suspect the son has got the wax gene from his father. So I'm just going a bit higher up, trying to bring this down, roll it forwards. The wax that's a bit deeper, it's darker, so it's been there for longer, it's oxidized. And generally with wax that's a bit deeper, it can be a bit dry because it's not exposed to the natural oils and sweats that the ears secrete, which is normally located on the outer third of the ear canal. However, sometimes when you've got a fully occluding wax plug, it creates humidity in the inner part of the ear canal, and that can also then cause the deeper wax to be mushy. So I'm just wriggling this out. The entrance was a bit bendy, so I'm going to move this from right to left. Just trying to find a better suction grip, and I've just gone a bit higher there. So we're now past the first bend. We're just going to wriggle this out the ear. So with this wax now, we could see it with the naked eye. I'm not even sure if I was looking at the camera. Maybe I think I was looking at the wax with my naked eye. Nearly there. I could have probably just used the correct, but by the time I got the correct, come back to the ear, it's just easy to continue with suction. There we are. So that is actually out the ear now, so just trying to take it from the patient's ear to the tissue. Actually, still putting a bit of a struggle, fight, isn't it, the wax? But I can actually see inside the patient's ear canal now. It's just got lodged just behind the tragus, which is the triangular piece of cartilage that we have just before the entrance of our ears. So just going to get the eardrum in focus. They had quite a long ear canal, and the reason why we know that is when I adjusted the focus, I had to adjust it a bit more than the norm, which means that the ear canal was a bit longer. So this is their right side, similar texture. In fact, this was a bit more mushy, at least laterally. So I've just gone in with the medical grade olive oil straight away. Again, we can't see the ear canal at the moment, so we've got to be really careful when we position the suction probe. Don't want to embed it against the ear canal. And most people's ear canals, there is an upwards incline of about, I think on average, 32 degrees. Obviously, there's variation. So when you're working to the bottom of the ear canal in particular, you've got to be careful because the canal wall can be going up. So if I push this too deep, I could be hitting the upwards incline of the ear canal. So I'm just trying to reveal some of the ear canal wall itself, so I've got a better idea of where to navigate. I can see a little bit at the bottom there. I'm just trying to suction it up and away, and there we are. I can see some of the pink flesh. So it's quite sticky with some sticky skin here. I think I had to use drops on several occasions actually. I had to remove this by layers. So this bit here is quite mushy where the suction probe is, so I'm just going to put a bit more oil, I suspect, and I'm just going to go a bit higher up as well. And I'm just going to lift this off the back portion of the ear canal, the posterior canal wall. The secret with this wax is that you don't want to embed the suction probe too deep into the mushy wax because it'll just block it. So you almost want to kiss the surface and allow the suction power to generate. So there's a bit more oil. So I'm just hovering over the surface of the wax, allowing it to generate the suction power, and you can see it slowly just lifting away. And on the periphery here, this is just a layer of skin that's enveloped itself around the wax plug, and it's also still attached to the ear canal wall. So I'm just going to bring that away. So this wax is quite medially located where I am now, so I'm just trying to bring it forwards. Slightly matted, there's a few hairs there as you can see. Now I can feel it coming away. I'm just going to bring it, tuck it in from the left hand side, the posterior canal wall. And similarly to their left ear, when I brought the wax out to the entrance, I could see it with the naked eye. So again, I probably wasn't even looking at the screens. I could see it by looking over the WAXscope into the patient's ear. So this patient's son has to attend twice a year, and this patient reported many years ago similarly having to have it removed twice a year, or sometimes even more frequently, but in more recent years it's been every couple of years, so it's not been as frequent. There we are, just moved out of the ear, so we're going to get the eardrum in focus. So they've got a bit more of a narrowing towards the eardrum in this side. Just going to mop up some of this soft wax just near the entrance. There's a bit of oil actually. So now a bit of wax is good for us. It's not going to do anyone any harm. Our ears produce wax for a good reason. It's there to moisturize the skin, to inhibit bacterial and fungal growth, and to trap foreign bodies if they do indeed enter the ear. So there's the wax plugs. I think the one at the bottom is off their right ear, the second ear. Well, I hope you enjoyed that video, guys. Take care, keep well, and speak soon. Bye.